Hypoglycemia refers to abnormally low levels of glucose sugar in the blood. It can lead to a range of symptoms and complications, especially in individuals with diabetes. Here's a detailed overview. Causes hypoglycemia can result from various factors, including diabetes medications, insulin. Excessive insulin use can lower blood sugar levels too much. Oral hypoglycemics. Certain medications for diabetes can sometimes cause hypoglycemia, particularly if taken without food. Insufficient food intake. Skipping meals or not eating enough carbohydrates can lead to low blood sugar. Excessive physical activity. Intense or prolonged exercise can deplete glucose levels in the blood. Alcohol consumption. Drinking alcohol, especially without eating, can cause hypoglycemia. Hormonal imbalances. Conditions like adrenal insufficiency or certain endocrine disorders can affect blood sugar regulation. Medical conditions. Insulinomas, rare tumors of the pancreas that produce excess insulin. Severe liver disease, can impair glucose production and regulation. Medications. Certain non-diabetes medications can interfere with blood sugar levels. Symptoms of hypoglycemia can vary in severity and may include mild symptoms, shakiness, trembling or shaking of the hands or body, sweating, excessive perspiration not related to heat or exercise, hunger, sudden and intense craving for food, dizziness, feeling lightheaded or faint, moderate symptoms, confusion, difficulty concentrating or thinking clearly, irritability, mood changes and emotional instability, weakness, feeling unusually weak or tired. Severe symptoms. Loss of coordination, difficulty with movements and balance. Seizures, uncontrolled muscle contractions or convulsions. Unconsciousness, loss of consciousness or passing out. Coma, the state of prolonged unconsciousness. Diagnosis of hypoglycemia involves medical history, discussing symptoms, medication use, and dietary habits with a healthcare provider. Blood glucose testing. Finger stick test, a quick blood test to measure current blood glucose levels. Continuous glucose monitoring (CGM) provides real-time glucose readings for individuals with diabetes. Additional tests. Oral glucose tolerance test (OGTT) may be used in some cases to assess how the body handles glucose. Fasting blood glucose test measures blood sugar after a period of fasting to identify potential issues. Treatment of hypoglycemia depends on the severity and cause of the condition. Mild to moderate hypoglycemia. Consume fast-acting carbohydrates, foods or drinks high in sugar, such as glucose tablets, fruit juice, or regular soda. The general rule is to consume 15 to 20 grams of fast-acting carbohydrates and wait 15 minutes to recheck blood glucose levels. Avoid high-fat foods. High-fat foods slow down glucose absorption and are not recommended for immediate relief. Severe hypoglycemia. Glucagon injection, an injectable hormone that raises blood glucose levels. It is used in emergencies when the person is unable to consume food or drink. Emergency medical care. For individuals who lose consciousness or experience seizures, emergency medical assistance is necessary. Intravenous glucose may be administered in a hospital setting. Long-term management. Adjust medications. Review and adjust diabetes medications with a healthcare provider to prevent future episodes. Dietary modifications. Implement a balanced diet with regular meals and snacks to maintain stable blood sugar levels. Monitoring. Regular monitoring of blood glucose levels to identify patterns and prevent hypoglycemia. Prevention. Regular monitoring. Frequent checks of blood glucose levels, especially for individuals with diabetes or those on medications affecting glucose. Balanced diet. Consuming regular, balanced meals with appropriate amounts of carbohydrates, proteins, and fats. Medication management. Proper use of diabetes medications and adjustments as needed based on blood glucose monitoring and medical advice. education. Learning to recognize early symptoms of hypoglycemia and understanding how to manage them effectively. Conclusion: hypoglycemia is a serious condition that requires prompt attention and management to prevent complications. If you experience symptoms of low blood sugar or have concerns about your glucose levels, consult with a healthcare provider for appropriate diagnosis, treatment, and prevention strategies. Regular monitoring and management are key to maintaining stable blood sugar levels and ensuring overall health.